Hello, my name is Stephen Agwonhese. This is my video presentation of the interview I had with my with the case manager of the agency I choose. Her name is Brittany, and I asked her basic questions about the agency, and she was really thorough when she answered most of the questions. And on this presentation, to probably summarize the agency and what we talked about, the first question I asked, the first question from the list of stuff we're supposed to talk about is to describe your case manager agency and the areas of expertise. So the my case manager's agency, the name of the agency is called Indiana Mentor. Indiana Mentor was found in 1985. Indiana Mentor is a leading home and community-based human services provider for adults and children with intellectual and developmental disability. You know, people with medically complex needs. These are the kind of people they deal with. The agency offer personalized support to help people of all abilities strive in the community they call home. They also offer services to children and families with unique challenges and foster families. The agency is so embracing. They have all kinds of aspects to help elevate human life, especially if they have to deal with people that have mental disabilities or developmental disabilities. That is one aspect they are so good at, and they be around for a little bit. So I mean, if they have been around for since 1985, so they are really deep in the community in terms of providing human services support to people that can really help themselves. They are into advocacy. They speak for people who don't have voice, and that is what the agency is really known for. That is the area of expertise and all that. Yeah. So the second question is, what did you learn from your case manager? First of all, I mean, like I said, she was so thorough and she sounded very professional. First of all, I learned to be a case manager. One have to have all the patience in the world, and most importantly, for one to do the job, it has to really be an area you want to be, because uh like she was talking about, it has a lot of challenges. I mean, you have to deal with people of all kind. You have to deal with the government. You have to deal with the changing regulations that come with the government in terms of funding, in terms of a lot of them use Medicaid. Different governments come in, they probably threaten or make plans to reduce the allocation that are meant for these special people. So these are all the things that, I mean, like she explained, those are not, they're stressful. You stress yourself. You think about people who need these services. They might not be getting it because they have the government allocation, so it might be reduced in certain ways that affect everything that surrounds them. They don't work. They depend on those finances from the government to actually sustain them. Another thing I learned, like, I mean, once you have a lot of empathy to work with this population, if if you're not patient, you can't work with it. Like what she was telling me, a lot of people here have, when people have issues, they don't know how to control. Like, they might know how to control it, but because of, some circumstances beyond their control, they don't know what is going on. It's not their fault. It is most likely what they are diagnosed with, or what is going on in between their head that nobody really knows what it is. So that is empathy. It's another thing I learned from talking to her. If you want to be in this field of work, you have to have the empathy. You have to know what it means to be in another person's shoes. That is another thing. And I also learned that you have to have the ability to be very, very courageous and work extra miles. Ability to work with, ability to work for long hours, and also to be a great communicator, because you will have to be working with all kinds of teams, like other case managers. You have doctors, nurses, and all that. So the ability to be a great communicator, it will put you in a position where everybody have to be on the same page to make sure you are able to provide the highest quality of care for those clients. Because if everybody works together, and you can have a great team if there is no communication about people that are trying to provide services for those people. So these are some of the things I learned from interviewing Miss Brittany. Then the next question, which is describe what it's like to interview a professional. I would say of that, it was quite different from, it was different from talking with ordinary person. you know uh During the interview, she sounded like someone with a lot of details about what she does, and most importantly, the professional approach she used in concluding issues was so great. You can tell, and you can tell and understand she knows what she's talking about, because she has been in the business for so many years, and she knows what it takes to advocate for this class of people. It was for me like it was for me like looking forward to jumping into being a professional like her, because all the answers she gave me was so professional, for every question I asked. So for me, basically, if you ask me what it is that I really enjoy about interviewing a professional, I look forward to being like, maybe one day be able to talk and display issues like her, and have a very thorough understanding of how the system works, in case you want to advocate for this class of people. So that is one thing I learned from conducting this interview with her. So the next question, which is, what question did you ask? I actually asked her, the question I asked her, which was where the interview was actually like all about, is how does the changes in government affect the way you run your agency in terms of caring for those people? She made instances with, when government changed, like during COVID, when there was a lot of staff to work with. She kind of explained it was heavy to care for those people. Most importantly, she was able to make me understand the changes in government. Maybe when one party comes into government with good regulations, and the other one coming with trying to cut regulations or cut the level of allocation for those population of people, it has a way of having, I mean, a toll on the services they provide for these people. I mean, sure, like take for instance, there are people supposed to be on free medical insurance, like Medicare, which is what most of them are on, Medicare and Medicaid. But sure, like when you have government who comes with regulations that want to cut all those services, it's difficult for them to manage. That was one area we talked about, and she was able to break it down piece by piece. I mean, the difficulties associated with dealing with stuff like that, which I really understand. Uh, I mean, she was, I mean, full of encouragement to even carry on in midst of the difficulties because of the empathy she had and the willingness to help all those people. But that was what we talked about. Then the next question is, what did this thing that was not, what did they share that was not a part of your question? Yeah, well, one thing she shared that was not a part of the question was, I mean, the stress associated with the job. Most importantly, she did talked about, I mean, like the idea of having to deal with families of those clients who don't have really a grounded knowledge of how government changes and regulations could affect the quality of service that these clients get, you know. And most importantly, is that she said that could really be stressful. Like when you deal with parents that just refuse to accept that it have to be one way. It's either good or nothing at all. You know, they say you struggle to strike balance between parents who try to be too much in control of what happens or what doesn't happen, knowing that they can't really do anything if for example the government cut finances for them. There's nothing you can do. You just have to advocate and see if you can increase a little bit the level of finances they get from those government system or not. But you know, she kind of explained the difficulties probably have on her personally and his family is general. So she acknowledged it's a struggle to be in this area of this area of perfection, which I completely understand. And the last but not the least question was, what did you wish you have asked them? You know, I wish I have more. On that, I wish I have more questions to ask. All the question and information I needed, I mean, was given a very detailed understanding, you know, and all the issues I talked about were all addressed. You know. So I know if I have more opportunities, I want to ask a series of questions from how their agencies and how they provide services at all levels. But I was just trying to stay within the limit of my scope to make sure I stay around what I'm supposed to be asking or not. But in totality, you know, all the questions I asked were greatly answered with some very high level of professionalism. And I thank her for that. She did a good job.